today we're going to be doing PIV insertion. We're going to be doing PIV dressing change and PIV removal as well. Okay, so the first thing we got to do before we place a PIV is to determine if the patient has any restrictions on his or her arms. If the patient has an arm restriction and vascular access team is working, please give them a call first before you try to attempt any placement. So this patient, we're going to pretend that does not have a PICC line up here. So we have the whole forearm and the hand to place an IV. We never want to go up in the upper arm to place any PIVs, as this is for PICC line placement, midline placements, and we want to preserve as much of the vessel as we can. So the first thing we're going to do when we're going to place an IV is, like I mentioned before, we're going to ask the patient if they have any restrictions. So this patient does not have any restrictions. And the other thing that we want to ask is if the patient has any allergies to the chlorhexidine that we use to clean the skin or to the dressing. In this case, this patient does not have any. If the patient does have an allergy to chlorhexidine, what we would use is we would use alcohol wipes and iodine, and then if they have an allergy to the dressing, we could try to do with just the regular Tegaderm. Okay, so the first thing I'm going to do is I'm going to sanitize my hands, and then if you're assessing for vasculature, you're able to do it just with clean hands. You don't have to wear your gloves. So the rule when placing IVs is you start from most distal to more proximal, and we stop at the AC. We don't go above the AC unless the patient is dying and you need to obtain vascular access. So in this case, I'm not going to do the hand because they tend to be very painful, and it's not practical for somebody that has been admitted into the hospital because the patient won't be able to wash his or her hands. So what I'm going to do is I'm going to go right here, and as you can see, there's a nice juicy vein here. We call this a cephalic vein, and this tends to be the largest vein in the forearm. So I'm gonna feel for the vein, make sure that there's a nice bounce to it, and then we're gonna get ready. Okay, so what I'm gonna do is I'm gonna sanitize again. Get my gloves. And then if you have your supplies, we're gonna have always so let's say that the patient is in bed, your supplies need to be above a barrier. You could use a clean towel, you could use a poly drape, you could use paper towels, as long as it's not touching the patient's bed sheets or anything directly. And that's it. In case something falls from your kit, it's still protected. Okay. So what I'm going to do is I'm going to open my kit here, and I'm going to leave everything inside the kit. I'm not removing anything from the kit. So before I poke the patient, I'm going to make sure that everything that I need is going to be handy right when I use it. So when you grab your needleless connector, you want to make sure that you do not contaminate the tip. If you do, then you have to clean it with alcohol before you attach it to your flush. So I'm going to prime it. There we go. I'm just going to leave it there. I'm going to open my catheter. And with the catheters, you have to try to open it and close it slightly, because during the sterilization process, this tends to get stuck. And sometimes when you try to retract the needle while you're actually, cannulating the patient's vein, you might retract the whole catheter. So we want to make sure it's nice and easy there. Okay. So then what we're going to do is I'm going to just feel one more time where I want to go, and then I'm going to clean with the CHG. With the CHG, you want to make sure you scrub for a total of 30 seconds or more, and you want to make sure you're using the number sign. Okay, so as you can see, I'm scrubbing past where I'm supposed to be poking, because the dressing, it's important too. You want to make sure that where the dressing is going to go, that it's also nice and clean. Dressings are changed every 7 days or as needed. if the dressing is not intact, if it's been contaminated, or if it's soiled. There we go. So once I do the 30-second scrub, then what I'm gonna do is I'm gonna get my tourniquet and I'm gonna place it. Tourniquet time should always be less than 1 minute, especially if you're gonna get blood. And that's because when you have the tourniquet on for more than a minute, it has shown to create hemolysis or hemoconcentration in your labs. So we want to make sure that we're doing it right. So we're going to place the tourniquet. There we go. And then I'm going to grab my catheter. I'm going to remove the protector of the catheter here. And then I could anchor the vein like this, like this, like this, whatever works for you, as long as you do not contaminate your insertion site. I know some nurses like to go back and touch back the insertion site. If that's going to be your case, you have to wear sterile gloves to do the insertion, or you're going to have to get a second CHG cleaner so you can go back and clean your site for 30 seconds again. So I like to secure the arm like this. So if the vein is superficial, we're gonna go in at about 10-15 degree angle. Once I'm inside the vein, I'm gonna advance my catheter to about 50%. And once I'm about 50% inside, I'm gonna start retracting my needle and introducing my catheter. Very good. So my catheter's in. I'm gonna let go of the tourniquet. I'm gonna grab gauze and I'm gonna cover my insertion site because I do not want to contaminate my insertion site. I'm gonna retract the needle if you haven't done so already, and then very important, I'm gonna clamp. So once I clamp, I'm gonna come here, and your catheter is not going anywhere, but you have to work close to it here. Remove that here, attach it. I'm going to unclamp again. I'm gonna flush a little bit, and then I'm gonna check for blood return. Make sure that no blood goes inside the syringe. And once you do that, you flush. Minimum flush is 5 mLs. Okay, so if there's any blood or anything like that, you could use that same gauze to clean. And it's a one-time pass only. If you need a new gauze, you could always grab a new gauze. Very good. So now we have something called a hub guard. And what the hub guard does is it protects the patient from a skin injury from the catheter wings. So it's a double-sided foam tape, and this part where I'm holding, it doesn't have any adhesive. So then I'm gonna grab the catheter by the tubing here, and I'm gonna press down, and then I'm gonna pull apart, and that's gonna help secure the catheter as well. Then I'm gonna grab my dressing, remove the top portion of the dressing, and I know some nurses like to follow the tubing. That's up to you, as long as you don't contaminate your insertion site. So I'm gonna make sure that my whole catheter is visible with the dressing. I'm gonna remove the bottom portion of the dressing here, and then I'm gonna get my belt or pants and place it underneath. If the patient is very hairy, the dressing is not going to stick. So what I recommend is for you guys to place your dressing and then put a Tegaderm on top, and that should do the job. Okay, then I'm going to grab my swab cap, and then I'm going to grab my tape, and this is how you like to do it. There's no preference on this. This is your choice. So I don't like to put tape on the patient's skin because it hurts when you try to remove it. So I like to keep my dressing on my tape on top of the dressing. Okay. And then once you have that, then you have to initial and today's date. There we go. And then you would document it in CPRS. Okay. So that's your IV insertion. Next, we're gonna do. So it has been 7 days, and we're gonna be changing the dressing for this IV. So we always try to keep the IV in as clinically indicated, meaning that if the IV is working well, the patient's not complaining of any discomfort, meaning any pain, any burning, it doesn't look red at the insertion site, we leave the IV in. As soon as the patient says that the IV is hurting or it's burning, we have to remove that IV, and then we have to place a new one above that area. We would never place an IV below an area of infiltration or pain or anything like that. We would need to allow the vein to heal for at least 24 hours before we could place anything under it. So you could only move up, never down, okay? So first thing I'm gonna do is, I'm gonna sanitize my hands. And then so what I'm gonna do for an IV dressing change is, I'm gonna need IV dressing kit. We're gonna need a flush, and we're gonna need some alcohol swabs. Excuse me. Okay, we're gonna need alcohol swabs. Putting on my clean gloves. And the way that we remove IVs, it's the same way that we placed it, but backwards in terms of the dressing. So I'm gonna start out with my tape. And if something else wants to go with it, you're welcome to do so as well. Okay, and then I'm gonna open this section here, and we always go distal to proximal to the insertion site. Okay, so I'm gonna do that there real quick, and then I'm gonna open here. And I'm just gonna grab my CHG just to help remove some of the adherence from here. Okay, so all dressing is out. Same thing, we're gonna clean at the insertion site for at least 10-15 seconds, and then on top of the catheter, and then I'm gonna lift and get underneath the catheter here.
Yeah.
We're good. So we're gonna clean underneath it here, and then around it. And you want to produce significant friction on the skin to make sure that you're removing all the microbes. And you're never going to remove all of it, but you want to remove as much of it as you can. So you could leave the hub guard in place there. And then what we're going to do is, we're going to grab the new dressing. And then we got to make sure that the skin is nice and dry before we place the new dressing. So we're going to pretend that it's dry, and we never want to fan or blow air, just to make sure that it dries faster, okay? Because then you're recontaminating that area. So remove the top portion of the dressing, hold down to the corners here. Make sure that your catheter is nice and visible throughout. Or the belt, if I find it. Here it is. And then you're going to grab your tape. Just do the bottom portion of it. And then I'm going to set up my flush. And you could do this before as well. I'm gonna find my alcohol swabs here. And then I'm gonna make sure that I'm clamped. And then 15 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Grab onto the alcohol wipe. Go the protector component. Because this is an older IV, you might not get blood return, but remember what I said. As long as the patient is not complaining of pain or burning, it doesn't seem like the IV is infiltrated or there's an infection, we just flush the IV and we leave it in. So we're gonna flush minimum 5 mLs, and then we put the swab cap on again. And then I'm gonna do the second portion of the tape to secure the catheter here. And then you have to initial and today's date again. Okay, so how do we do a PIV removal? Pretty much, we're gonna pretend that this is brand new gauze right here. So what we're gonna do is, we're just literally lifting around all the sides. You know, grab your gauze. You could fold it in half, and then find your insertion site, place the gauze and remove. Put pressure on it. 10-15 seconds. If somebody is on heparin or an anticoagulant, you might have to hold it a little bit longer. And then just do a little pressure dressing. And then after 2-3 hours, that pressure dressing could be removed. And that's it. And then you would document both the dressing change and if you remove the IV in CPRS. And that's it.